you. So I'll start off. So my name's Jessica. I'm a pharmacist, a primary care pharmacist working at a family health team. And I have my colleague Brenda here today who works at a family health team as well at St. Michael. She's at St. Michael's and I'm in the East End at Southeast Toronto Family Health Team. We've listed our emails there just for your reference. If you have any questions, you're more than welcome to email either of us after this presentation. Next slide, please. We have an acknowledgement there. I won't go through it since Dom did such a great job already. So next slide, please. For disclosures, I have no current or past relationships with commercial entities. Brenda did have some financial support for consulting work that she completed with Cascades in the past. Next slide, please. We'd just like to acknowledge all of the students that have worked with us, both medical and pharmacy learners, as well as our physician colleagues who have worked with us on some projects. Next slide. So at the end of this session, we hope that you'll be able to take away some information about the environmental implications of metered dose inhalers, as well as explore potential change ideas within your own practice settings to improve the sustainability of inhaler prescribing. Next slide, please. So what I'm going to go over first is a little bit of the background about what the problem is and why we want to be changing our current practice. Next slide. So I'm going to start with a polling question. So I'd like to get a sense from the audience, which of the following potential risks of inhaler therapy is most important to you at this time? So patients may have a delay in their proper diagnosis, patients may experience unwanted side effects from inhalers, they may acquire unnecessary financial costs, or may contribute to greenhouse gases with the use of their inhalers, and then lastly, can't decide as they're all important risks. Many of you selected the last response. There's also quite a number of you that selected the first response as well. In reality, there is no wrong answer to this question. These are all concerns that we have in terms of inhaler therapy, the risks of inhaler therapy, and I'll get into a little bit more detail about them on the next slide here. So the harms of overprescribing inhalers for an unclear or unconfirmed diagnosis are well documented. One of the first ones that I'd like to touch on, which actually wasn't mentioned in the polling question just before, is the risk of encouraging patients to label themselves as sick. So we know that oftentimes the typical duration of a cough, a post-viral cough, may last longer than many patients expected to. And so even though they're just experiencing the natural course of an infection, they may think that something is in fact wrong, and encouraging that by prescribing inhalers can encourage that labeling of being sick. And in addition, there may be more benefit to just more education around the timelines of coughs rather than prescribing inhalers that really do actually have no evidence of benefit for the treatment of post-viral cough. The next is the risk of delaying proper diagnosis, so covering up signs and symptoms that may delay investigations that could help uncover diagnoses. The next is medication side effects that we're all familiar with, as well as medication and inhaler costs. We know that they're all most are all quite costly amongst the inhalers. And then, of course, there's the environmental costs, which often we don't think about so much, but is definitely an indirect cost that we'll be focusing on today. Next slide, please. So a little bit about the history of the environmental impact of inhalers. So of course, the manufacturing process and the distribution process of inhalers in itself has an environmental impact, but beyond that, the propellant used in meter dose inhalers specifically does have a significant environmental impact. In the past, there used to be chlorofluorocarbons that were used as propellants, and then that was phased out in the late 1980s because of their ozone depleting effects, and we've moved more towards safer substances like hydrofluorocarbons or hydrofluoroalkanes, which are non-ozone depleting, but they still are potent greenhouse gases. Next slide, please. And we know that generally speaking, about 1 meter dose inhaler that has about 100 doses in it is roughly equivalent to a 290-kilometer car journey. So that's quite significant if we stop and think about how much impact that really has on the environment. There has been recently a little bit of debate around that exact 290-kilometer car journey estimate, but it is more or less around that range. So pretty significant nonetheless. Next slide, please. So if we think about it a little bit further, we end up having this paradoxical relationship where patients are prescribed inhalers initially to try and help with their lung health, but then that leads to carbon emissions and contributes to climate change. And then we have, increased heat waves, smog, that sort of thing, that then ultimately ends up exacerbating respiratory conditions. And then people whose lung health was once controlled then need more inhalers to try and control their breathing. And so we can try and disrupt this cycle by encouraging more environmentally sustainable options. And that includes more judicious prescribing practices, as well as switching people over potentially from MDI inhalers to others more suitable alternatives. Next slide, please. So here's the next question for you, just to get a sense of the knowledge in the audience. So which of the following is correct? The average dry powder inhaler produces 50 to 60 times less carbon footprint than an MDI, 30 to 40 times less, 10 to 20 times less, or less than 10 times the carbon footprint of a meter dose inhaler. So most of you went with the first option, which would feel like the right option given the nature of this talk. In fact, the right answer is C, 10 to 20 times less carbon footprint. And when we think about it, this actually is fairly significant, especially thinking about maybe your average patient who has COPD or asthma might be on about 10 meter dose inhalers per year. And so if we were to switch that to a dry powder inhaler, we could get away with about 100 to 200 times less carbon footprint in a year. So pretty significant and something that we should keep top of mind. Next slide, please. So just going in a little bit more detail there, so the carbon footprint of inhalers, we can compare them by using this number called the CO2 equivalence, and that compares basically the amount of gas that is emitted into the atmosphere when an inhaler is used, as well as takes into account the global warming potential, which is a number or a measure that's used per individual gas or propellant that's used and is intrinsic to the properties of that gas. So using those two different figures, we can figure out a CO2 equivalence for a specific inhaler device, and then we can compare across to see the difference. And so you can see that Respimat devices or soft mist inhalers, as well as the dry powder inhalers, are significantly less in terms of their carbon footprint compared to the meter dose inhalers. Next slide, please. So I hope I've given you a sense of the problem or the impact, and now what can we do about it? So there are some actions that have been proposed by the Centre for Sustainable Health Systems, which is a group in Toronto that aims to improve the environmental response across the healthcare community. And their first suggestion is developing suitable prescribing practices around inhalers. So that includes kind of trying to abandon that knee-jerk reaction to prescribe an inhaler when there's not a confirmed diagnosis. The next is encouraging alternatives to meter dose inhalers, as I just went over, so other options that have less impact on the environment. The next is ensuring appropriate inhaler usage, and that's really at the user phase, the patient phase. So if people are using their inhalers not properly, more propellant is released into the atmosphere. So if we can provide education as well as encouraging the use of spacer devices, then we can get less of that released into the atmosphere. The next is practicing sustainable recovery and recycling of inhalers. And we know that many patients are just throwing their inhalers in the garbage or recycling, where they end up in landfills. And in the landfills, then the extra propellant that hasn't been expelled yet from the device is just released into the atmosphere. Whereas if patients took it back to the pharmacy and they were disposed of properly in like the Stericycle containers or what have you, then they would be incinerated, which tends to lead to lower carbon emissions. Next slide, please. So just a note on optimizing inhaler technique, there's a big role for pharmacists and pharmacy team members to help in teaching how to use inhalers properly, and it can really benefit in terms of reducing carbon emissions with that propellant being expelled. This is just one example of a resource that's available through the Cascades website. It's a nice PDF that when you hover over the images of the different inhalers takes you straight to video links from the Lung Association about how to use the inhaler. So it's a nice resource to maybe have handy on a desktop near a counseling area in a pharmacy. Next slide, please. So one last question for you. In your current practice, have you informed your patients about how to discard used or old inhaler medications? So you have a mix across the board. I think, in thinking through this and asking myself this question in honesty, I typically was not in the habit of counseling patients about this. And, in going through some of these projects and learning more about this area, I realized it's something that is a pretty easy change idea, pretty easy, like one-liner to add into your counseling to patients, and can make a pretty significant difference. A lot of patients are pretty surprised when this is mentioned to them. So it is something that is probably easy enough to add in and can be a pretty easy change. Next slide, please. So just a couple notes on inhaler disposal. So incineration of MDI inhalers saves about estimated 3 to 17 kilograms of CO2 equivalents per inhaler, depending on the device, compared to just landfill. Most community pharmacies accept medication returns via the Health Products Stewardship Association that are serviced by Stericycle or ECS Cares as examples. And it is a free charge service and voluntary for pharmacies. In the hospital pharmacy world, many hospital pharmacies are partnered with similar medical waste disposal companies. The city of Toronto specifically does not recycle inhalers, and we don't know about other municipalities specifically, but likely the same as well across Ontario. And then no pharmaceutical companies currently offer disposal program of inhalers in Canada. Some used to in the past, and then they phased that out. But we do know that some companies like AstraZeneca are working on trying to bring programs like that back. Next slide, please. So just taking a quick little one slide detour to talk a little bit about therapeutically how this fits into the whole environmental piece. Next slide, please. So while most of the our focus for the presentation is on the environmental aspect of inhalers, it fits nicely with the therapeutics in terms of specifically asthma management, because the 2018 Global Initiative for Asthma and Canadian Thoracic Society guidelines updated to recommend combination formoterol and budesonide, which is available as Symbicort Turbuhaler, over a SABA alone as the preferred reliever option for asthma treatment. And that's basically because it was found that formoterol is quick enough acting like a SABA to relieve shortness of breath in quite quickly. And the combination of an added steroid in there at the same time does end up reducing asthma exacerbations and symptoms as well. So in terms of from a therapeutics perspective, if you're encouraging someone to consider switching over to a dry powder inhaler from an environmental perspective, this can be kind of added in as a nice addition to it that therapeutically it's also recommended as well. Next slide, please. Sorry. Thank you. And now I'll pass it over to Brenda to finish up the presentation.
Great, thanks, Jessica. So I'm going to spend the next little while talking about some of the tools that Jessica and myself have used within our family health teams and in our primary care setting to sort of spread these change ideas. And then as well as talk about some strategies that we've undertaken, and as well as give you some ideas, maybe perhaps strategies that you can embark on in your clinical area of practice, or even if it's a non-clinical area of practice, just some things to think about in terms of promoting this topic around inhaler use and more climate conscious inhaler prescribing. Next slide, please. So I'll talk specifically about 4 areas. So the first area is really around prescriber education and supports. So within our family health teams, we did develop what we call prescription favorites to facilitate prescribing. And I'll go into a little bit more details in terms of what that is in the next slide, as well as inhaler charts and handouts that we've embedded in our electronic medical record system so that providers have tools that they can access to choose a more appropriate inhaler if they wish to. The next area is in the area of patient engagement and awareness. So both our sites embarked on putting up posters in the waiting rooms and the clinic exam room so that patients became more aware of this topic. So we'll give you some examples of some of the posters that we've used in our various primary care settings. The next area is really related to quality improvement projects as well as measurements. We've had a lot of interest actually from our learners, both medical residents as well as pharmacy students, to take on some of these projects around the inhalers and the quality improvement aspects of this topic. And we'll share with you a little bit of the data that we've continued to track within our family health team. And lastly, we also wanted to highlight upon community pharmacy engagement. So while the two of us are in primary care, we have partnered with our community partners as well to put patient information sheets that we can attach to prescription bags that are outgoing to kind of inform our patients about this topic, as well as give you an example of a pharmaceutical opinion template that could be used. Next slide, please. So before I talk about the tools specifically, want to highlight that many of these tools and resources are now available on the Cascades website. So Cascades is an organization of various healthcare professionals that's really interested in looking at creating a sustainable healthcare system. Their focus is quite wide. So the inhaler issue is one aspect in the primary care setting as well as in the inpatient setting, but Cascades certainly does look at various other areas that impact climate and healthcare systems. So a lot of these are available there. Next slide, please. So I'll start off by talking a little bit about prescription favorites. So within our family health team, we use Practice Suite Solution as our electronic medical record system. And with this EMR, we are able to build prescriptions that we frequently use. And so from these prescription favorites, and using them for other things, we've decided to build all these inhaler prescription favorites as well. So we titled these all #inhaler, so it's easy to find, so that all of the pre-built orders, if you want to look at it that way, all show up together. We built them for asthma, we built them for COPD, and I know it's very fine print here, but you can see that we put in the category for each of the inhalers as well. So is it an ICS? Is it an LABA? We added the brand names because inhalers are easy to remember by brand, particularly the combination ones. We also put in 4 letters of the generic name so that you could still identify what product you're actually prescribing, and then some additional information like, for example, the appropriate age, if there's an age indication, and some limitations if there were any around ministry coverage information. So for us, it would be the Ontario Drug Benefit Program. If it was not covered, we would highlight that in the title of these prescription favorites. But more importantly, for any metered dose inhaler, we actually didn't pre-build these orders, but what we did was we created a prescription favorite where in the title we would say, consider first a dry powder inhaler, and we gave the examples of what would be an equivalent one. So on the slide here, you'll see that we highlighted Advair metered dose inhaler and Flovent metered dose inhaler. And you can see for Advair, we suggest, consider Advair discus, the Brio ellipta, and then for Flovent, you can consider a Flovent discus, Pulmicort, etc. So we did give options to sort of guide our providers that they can select something different if they, in their mind, was thinking to prescribe Flovent, for example. Next slide, please. And I know this is probably hard for you to see, but in our handout section, we did put in some infographics and handouts that really guide our providers. So if they were given or if they were prescribing a previous inhaler, if they were interested in switching over to a greener option, this is an example of an infographic that gives them an idea of what would be a reasonable alternative to consider. This was developed by Jessica for the Southeast Toronto Family Health Team, and it includes coverage information so that providers could select the appropriate options to choose. Next slide, please. So moving on, these are some of the patient waiting room posters that we put up. So on the left is a poster that was used at the Southeast Toronto Family Health Team, and on the right is the green one is the one that we used in our St. Michael's Academic Family Health Team. And although they look slightly different, the key messaging is the same. We really want to just let our patients who come into our clinics know about this issue. And if they've not heard about it, then they can learn something from reading the poster. And it gives them an opportunity then, if they wanted to learn more, to talk to their providers or to talk to their providers about a possible switch if it was relevant to them. So these have been put up. We also had other posters, but these were our main posters that we put up. Next slide, please. And then next, we had a lot of interest actually from our learners, and I hope that some of you joining us on the webinar today are actually learners, or you are preceptors and you take a lot of learners, because certainly at the St. Michael's Academic Family Health Team, we had a lot of learner interest in this topic. So first, I want to share some of the work that we did with our medical resident in the year 2021. We launched our prescription favorites as well as the patient room posters or waiting room posters all at the same time as our change idea on Earth Day of that year. And we tried to capture the number of inhaler prescriptions prescribed for the 8-week period before the change ideas, as well as the 8-week period after the change idea. And what you see on the bar graph there is the number of inhalers being prescribed, blue ones being for dry powder inhalers, and the pink orange color being for metered dose inhaler. And you can see over time, by about week 15, 16, or the end of our kind of data collection period, you do see the blue bar sort of exceed the orange bar, meaning that there was an increase in dry powder inhaler prescriptions versus metered dose inhaler prescriptions. We did also look at, the same time period for the 2 years before, so in the year 2019 and the year 2020, just to see if there were any trends, because we certainly know around like April time is allergy season, and so there may be more inhaler prescriptions, and we wanted to see if there was any influence. And we noted that the 2 years before, really the prescribing patterns were very similar, for the entire 16-week period. There was not an increase in dry powder inhalers, but for the year that we implemented the change idea, there was definitely an increase in dry powder inhalers over time. Next slide, please. And at my site, I had the opportunity to work with some of our U of T pharmacy learners as well. And we started doing one project around inhaler disposal. So the purpose of this quality improvement project was really to find out, one, how patients were currently disposing of their inhalers. We wanted to reduce the number of inhalers being disposed of improperly, as well as to determine if an initiative to collect inhalers was feasible within our family health team. And unfortunately, the last objective we were not able to achieve. It was not as easy for us to, create an initiative to really collect inhalers for our patients. But what we did learn was that most of our patients did not know how to dispose of their inhaler. And you can see on the graph there that like many patients that they were unclear. Most were throwing them in the garbage. Maybe a few would put them in the recycling or sharps container. But the overwhelming message back to us was that they were surprised. And, as part of this project, my student was able to also share with them, the proper ways to dispose. And our patients was really appreciative of the information. They learned something around the issue of inhalers. Next slide, please. And in terms of ongoing quality improvement measures, this is the data from the Southeast Toronto Family Health Team. As you can see, from March 2021, there were about 1,500 asthma patients that were on or prescribed a metered dose inhaler, remaining on a metered dose inhaler. And over time, they've made significant gains in reducing the number of their asthma patients that remain on a metered dose inhaler. Next slide, please. And similarly, within our St. Michael's Family Health Team, we track the data a little bit differently, but we did collect the number of inhaler prescriptions over a period of time. And this is a snapshot of inhaler prescriptions from January 1st to November 7th in the year 2022. And you can see from our sites, the number of metered dose inhalers still outperforms the number of dry powder inhalers. But the key is that we have made some gains in some of our clinics. So some of the quality improvement projects that I was talking about before mainly happened in our 80 Bond site, as well as our 61 Queen site, because those are the clinics that I cover. So you can see there is some difference in terms of the number of prescriptions that are being written for these inhalers. Next slide, please. And lastly, in terms of community pharmacy engagement, at the Southeast Toronto Family Health Team, they had provided this sheet that they shared with their community partners to attach to outgoing prescriptions. And it's really a QR code that lets patients scan and learn more about the environmental impact of inhalers. This particular QR code scans to the Cascades website, and it goes to the infographic that they've created for patients to really teach about this issue. Next slide, please. And as well, a pharmaceutical opinion template was provided to some of the community pharmacy partners to give them an idea that, if they were interested in partnering for this initiative and suggesting an inhaler change at the time of, let's say, a prescription renewal, they can use this template as an option to start a pharmaceutical opinion. Next slide, please. So I want you guys to sort of think about and reflect for your own current place of practice. What is the one thing that you might be able to do to promote practice change from metered dose inhalers to dry powder inhalers, or the one thing that you might do to mitigate the carbon footprint of metered dose inhalers? Feel free to use the chat if you want to share some of your ideas. But even if you didn't, if you're still thinking about it and not too sure, at least, we hope that by the end of this webinar, you can walk away kind of reflecting on this, because potentially there may be some things that you could do at your current site of practice. The other reflection point is, how might you involve a learner at your site if they were interested in this topic, if applicable to you? Some of you may be preceptors for pharmacy learners. So certainly at my site, there were a lot of interest from learners to kind of take on some of this initiative. And, the younger generation certainly have this in mind, top of mind in terms of climate change. So they are very much interested in learning about this topic and in coming up with creative ideas for projects themselves. And feel free to share if you want to share in the chat. Next slide, please. So some recap of what we did in terms of learner projects, the waiting room posters, the prescription favorites. We put up postcards actually at the provider's computer terminals that give them a quick idea of what to prescribe if they were interested in prescribing something different. We talked about inhaler disposal. We've also been doing some work currently on doing chart reviews for appropriate patients to have a pharmacy suggestion for what they could change the inhaler to. But in terms of what we think you may be interested in doing as other project ideas in the community or elsewhere, potentially could be in the post-discharge area, making sure that there's a good inhaler medication reconciliation. We often know that sometimes at discharge, patients are given other inhalers because maybe that's what's on hospital formulary, and patients may use two inhalers, unintended for those reasons. At times of medication counseling, perhaps more encouragement of proper use of metered dose inhaler with the spacer device so that there is less propellant being released into the atmosphere incorrectly. And perhaps a discussion around inhaler disposal can happen more at medication counseling time, or even ensuring that pharmacies, community pharmacies, or other places have placebo inhalers to at least show patients and counsel them on these other options as an option, because certainly at our sites, one of the feedback is, the patients are not comfortable using dry powder inhalers. MedsCheck is also a great opportunity to review technique and or suggest time for a switch if applicable. And then finally, any patient handouts, leaflets, or labels could be always attached to prescription renewals. So these are some of the thoughts that Jessica and I had for, a continued learner involvement or other project ideas in other areas. Next slide, please. So finally, we want to summarize at the end here that many of the tools and topic area for this can be found at the Center for Sustainable Health Systems from U of T, the Cascades websites, which we've talked about before, but there's also a great website from the UK called the Green Inhaler that really highlights this topic. Next slide, please. So that's it for our webinar presentation. We've listed some of our relevant resources and references here for everyone. Thank you for your time.
Awesome. Thank you, Brenda. Thank you, Jessica. I just want to ask the audience if anyone does have any questions or comments for our presenters, please just enter them in the Q&A box. Currently, we don't have any questions at all, but I was actually just sort of thinking about the stat you guys presented, the 100 meter dose inhaler doses equaling 290 kilometers in a car. That's a very staggering statistic that I don't think I'd ever considered before. And it certainly is a good opportunity to have discussions with patients around proper disposal, sort of knowing that there's that much impact from one single inhaler canister. Perfect. We do not have any questions. So with that, I would like to thank Brenda and thank Jessica for their presentation today. And I'd also like to thank Sandrine and Ecolofarm for sponsoring this education session today. If anyone does have any questions that they come up with after the session, you can always email us at education@opatoday.com. And with that, we'll also be posting this webinar to our webpage for anyone to view it afterwards. And with that, I'd like to wish everyone a great afternoon and thank our presenters once again. And have a great day, everyone. Take care.
You, Dom.
Thank you.
Bye.